In 2020, the World Health Organization reported that 25% of the world's sick people, all diseases combined, are African. With this in mind, African leaders are campaigning for far-reaching reforms to build a health architecture capable of achieving health independence by 2050. It is in this context that the pharmaceutical sector is a major challenge, in that access to affordable, quality medicines, as well as the implementation of appropriate public policies and public-private partnerships are factors in the development of the sector's growth potential in Africa.
Vaccine equity cannot be guaranteed by goodwill alone, as we have seen many examples to convince all of us. Africa needs to expand production capacity for vaccines and other essential medical products.
The United Nations believes that the COVID-19 pandemic has highlighted Africa's inadequate capacity to manufacture and supply essential medicines. Although Africa is home to 17.2% of the world's population, it produces only 3% of the world's pharmaceuticals, 375 manufacturers in 37 African countries. Over 80% of pharmaceutical and medical products are imported into the continent. Hence, the importance for experts of developing partnerships with international organizations to improve local production.
The Gavi, the Vaccine Alliance, at its December board meeting, it approved an instrument called the AVMA, Africa Vaccine Manufacturing Accelerator, which is a very important tool of 1 billion that will actually be strengthening the African vaccine manufacturing. So through that, we are hoping that we can get into a space where Africa can contribute to the manufacturing of its own vaccines.
The demographic boom in Africa and the growth forecast for the next 20 years could be the catalyst for change, as demonstrated by various development projects in the health sector, such as Gipto Pharma City, Egypt's new regional center for the pharmaceutical industry in the Middle East. With a view to meeting the needs of a growing population, CDC Africa plans to open 5 new vaccine manufacturing sites by 2040.
Africa CDC, nous faisons un programme.
In Africa CDC, we are running a major program called Local Manufacturing of Vaccines, Medicines and Diagnostic Tests. Our ambition is to have at least 60% of all these products manufactured in Africa by 2040.
60% de tous ces produits fabriqués en Afrique.
Insufficient human resource capacity and policy inconsistencies between trade, industry, health and finance departments are also hampering the growth of Africa's pharmaceutical sector. According to the AFDB, when all African countries ratify the FTAA agreement, it will include a market of 1.3 billion people and potentially 2.2 billion by 2050.